6-year-old girl is brought to the clinic with complaints of fever and sore throat for the past 2 days. This morning, she developed a rash on her face and neck, which is progressing towards the trunk. The teacher in her school reports that none of her classmates had the similar symptoms. She has a normal birth history. On physical examination, the child looks healthy. The heart rate is 90 per minute. The respiratory rate is 20. The temperature is 102.2 degree Fahrenheit and the blood pressure is 90 by 50. An oropharyngeal examination reveals circumoral pallor with a red tongue. The chest and cardiac examinations are within normal limits. No hepatosplenomegaly is noted. Which of the following is the most likely diagnosis? Option A, scarlet fever. Option B, erythema infectiosum. Option C, Kawasaki disease. Option D, roseola. And option E, measles. Scarlet fever, like most of you have answered correctly. Some options have been confusing for the people, so let's go through the question again. So basically, this question is telling us about circumoral pallor with the red tongue, as shown. This is a strawberry tongue, which is very pathogenic of scarlet fever. All right, and then they give us a history of fever and sore throat, after which the patient developed a rash on her face. Okay, and after the rash and everything along with it, the patient had a strawberry tongue and circumoral pallor. All these things directly direct you towards scarlet fever. Some options which could have confused you were erythema infectiosum. Okay, so erythema infectiosum is nothing but your parvovirus B19 infection. It will usually be mentioned that there is a slab cheek appearance or maybe a lace-like rash. They'll give it out specifically. Okay, but when there is a history of fever, sore throat, circumoral pallor, and red tongue, it is more towards your scarlet fever. Scarlet fever is caused by Streptococcus pyogenes. Okay, and if people remember my last class, I had talked about the toxin which causes it. Does anyone want to try before I tell you which toxin is responsible for the rash and everything? It's there in your first aid. It's there as a question everywhere. I had discussed it in the previous class also. Not in this context, but in another context. I'll remind you of that also. So yeah, I think a couple of people do remember. So yes, so we were talking about, if you remember, we were talking about the lysogenic phage bacteria, in which there is a toxin called erythrogenic exotoxin, which is responsible for this. And what context I had told you was, if you remember, I had told you about 5 bacterial toxins which are encoded in a lysogenic phage. Okay, so out of that, one of them is your group A streptococcal erythrogenic toxin. It's an exotoxin, not an endotoxin. I think someone mentioned endotoxin. Yeah, it's an exotoxin, and the name is erythrogenic exotoxin. All right, and so this is so you could rule out erythema infectiosum. One disease which will confuse you everywhere, be it you world or anywhere. They will try to confuse you with Kawasaki disease. But there is one very specific thing about Kawasaki disease. Whenever they're talking about Kawasaki disease, they will mention conjunctivitis somewhere. Okay, reddening of eyes, conjunctivitis. Age might not be very specific, and they might not mention that fever is there since 5 days or something. That is usually present. That is a general thing. But something which will drive you very specifically over there is your conjunctivitis, then erythema, edema of the hand, feet, or something. Okay. Other things are with it, but main thing which can help you differentiate is the conjunctivitis. All right. Other options are pretty basic. I don't think anyone was confused with them. So yeah, measles, they have cough, coryza, conjunctivitis, and Koplik spots. Roseola will have fever with a 3-day rash. After 3 days of fever, high fever, there will be a rash. And roseola also has seizures, febrile seizures, right? So yes.
Thanks for watching. Please give a thumbs up and subscribe for more.